It's day 11 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Akhil Kardidal, and over the next few minutes we will bring you updates regarding the spread of this virus from across India, with a specific focus on Bengaluru and Karnataka. At the time of this recording, 3,044 COVID-19 cases have been registered in the country. 3,115 people are active reported carriers of the novel coronavirus in India. 275 recovered since they were first tested. The death toll has climbed to 94. Till date, 69,245 tests for COVID-19 have been done across the nation, among which 10,034 tests were conducted yesterday alone. The Indian Council of Medical Research has approved testing using rapid antibody-based blood tests for COVID-19 reporting clusters, and also for centers holding large migration clusters and evacuees. All influenza-like illnesses will be subject to rapid antibody testing. If the test is found negative the first time, a repeat real-time PCR test will be conducted using a throat or nasal swab to confirm the presence of the novel coronavirus. If it is positive the second time, action will be taken as per COVID-19 protocol. All individuals with influenza-like illness symptoms have been advised home quarantine for 14 days. With an individual from St. Esteban, Goa now being reported positive for COVID-19, the number of positive cases in the state is now 7. Delhi reported 59 fresh cases today, and the tally in the capital stands at 423. In Rajasthan, 12 new positive cases have been confirmed and the death reported in Bikaner. With this, the tally of active cases stands at 174, including 41 Tablighi Jamaat attendees. Tonk City in Rajasthan is emerging as another hotspot in the state as 16 people have tested positive in the past 3 days. A 51-year-old COVID-19 patient who attended the Tablighi Jamaat event passed away in Tamil Nadu today. There are 475 coronavirus positive cases in the state, out of which 364 are Tablighi Jamaat attendees. With 16 new cases, Andhra Pradesh has 185 active cases. Nellore district tops with 32. 47 fresh coronavirus positive cases reported in Maharashtra today, with 28 in Mumbai alone. A 36-year-old COVID-19 patient passed away in Chhindwara in Madhya Pradesh. The total number of positive cases in the state is 155, with 10 deaths recorded. One person has succumbed to the coronavirus in Ahmedabad, and the death toll in Gujarat has now risen to 10. There are 81 active cases in the state. There are a total of 4 active cases in Himachal Pradesh, including 3 positive cases from those who were at the Tablighi Jamaat gathering. According to the Health Ministry, over 22,000 Tablighi Jamaat workers and their contacts have been placed on quarantine to date. As of today, 1,023 cases linked to the Jamaat have been found positive, accounting for 30% of all total cases. In the last 2 days, 600 people related to the Markaz Nizamuddin event have been quarantined in Delhi. 10 foreigners who attended the Nizamuddin congregation were tracked down in Bihar. The center handed over a list of 57 foreign nationals to the Bihar state government. Among these, 35 have been identified so far. Kodagu police have tracked down 9 Malvis from the Shura Tablighi Jamaat in Gujarat. They had been staying at a rented home in Virajpet Taluk. 10 men, including the house owner, have been quarantined. Karnataka recorded its 4th death last night. Patient 125, a 75-year-old man from Bagalkot, passed away in less than 48 hours after being diagnosed. Karnataka has seen 16 new positive cases today. With this, the active cases in the state stands at 129. 3 are in the ICU, while 2 of them are on ventilator support. Karnataka has tested 5,061 samples so far, with 400 samples collected for testing at the time of this recording. Of the 16 new cases reported today, 4 are from Bengaluru and are known contacts of other COVID-19 patients. Of the 7 from Mysuru, 4 have a travel history to Delhi. A detailed investigation is underway for 2, and the last is a direct contact of a known patient. 2 cases have been reported from Dakshina Kannada district. Both had attended the Tablighi Jamaat conference in Delhi. 1 case has come in from Udupi. The patient has a travel history to Dubai. 1 case from Hospate is under detailed investigation. 1 patient who is a resident of Cochin with a travel history to Germany is currently being treated in a hospital in Bengaluru Rural District. Any person from the state who has attended the Tablighi Jamaat congregation at Nizamuddin Markaz Masjid in New Delhi, kindly contact the Arogya Sayavani on the number displayed on the screen. Meantime, India has unveiled a 5-stage approach to fighting coronavirus, saying that the spread of the disease could be high but unlikely to affect all parts of the country uniformly. India will be following a scenario-based approach for 5 contingencies: travel-related cases, local transmission of COVID-19, large outbreaks amenable to containment, widespread community transmission, and the country becoming endemic to the disease. Prime Minister Narendra Modi will hold a meeting with all political leaders via video conferencing tomorrow in the midst of the lockdown. Prime Minister Modi's call to turn off lights on Sunday night has led to fears about a power grid failure. Karnataka's Power Corporation officials said that people following the PM's request this Sunday should keep home appliances running to ensure the health of the power grid. The Ministry of Power has clarified that these concerns are misplaced. Meanwhile, the Indian Army urged everyone to use soap to wash hands and not to use alcohol-based sanitizer prior to lighting lamps. With the cases of coronavirus infections soaring in Mumbai and Pune, CM Uddhav Thackeray has said that the ongoing pan-India lockdown may continue in Maharashtra after 14 April. No permissions will be granted for religious events, community gatherings, and sports meets. He also warned of stern action against those spreading community divisive messages on social media. Indian Railways has begun preparations to resume its service from April 15th after the 21-day lockdown. It has issued a restoration plan to all 17 of its railway zones, including a schedule of trains to be run, their frequency, and the availability of rakes. It has also asked all railway officials to be ready to join their posts. But 80% of trains are expected to run as per schedule from April 15th. These include Rajdhani, Shatabdi, and Duronto trains. Local trains too are likely to begin operations. Railway is likely to conduct thermal screening of all passengers and follow protocols issued by the government. However, Railway Board officials have said that the board will meet soon and take a call after getting a go-ahead from the government. The National Health Authority has announced a tie-up with Uber to provide transport service to frontline healthcare workers in the country who are engaged in the treatment of Covid-19 patients. Uber will initially provide 150 cars free of cost to support medical facilities in New Delhi, Noida, Ghaziabad, Kanpur, Lucknow, Prayagraj, and Patna through its recently launched Uber Medic service. Moving on to see what's happening in Karnataka regarding the COVID-19. Chief Minister B.S. Yediyurappa has said that he hopes that the lockdown be lifted in a staggered manner after April 14. In a meeting with all legislators from Bengaluru, the Chief Minister said that lockdown enforcement will be strengthened to curb unnecessary movement of the public. In response to various issues raised by legislators, he said that those who do not have a ration card will also be entitled to food grains. The CM also issued a strict warning to private hospitals that are closed or not treating patients. In Dakshina Kannada District in charge Minister Kota Srinivas Pujari said that 20,000 quintals of boiled rice has been released for distribution to ration card holders through the public distribution system. As people in the district prefer boiled rice over white rice, the government has approved the distribution of the same. From next month on, only boiled rice will be released to the district to be distributed in fair price shops. Rice will be distributed for the months of April and May. Every BPL card holder will get 10 kgs of rice, while Antyodaya card holders will get 70 kgs of rice. APL card holders will get 20 kgs of rice. The state government has given conditional permission to hold the famous Karaga festival, but directed festivities be held symbolically with only a few participants. Bengaluru Karaga is one of the city's oldest festivals, and the tradition is said to be at least 500 years old. The BBMP, which had initially assumed the responsibility of feeding labourers in all 198 wards, has scaled it down to 166 wards. Madhevapura alone has 20,000 migrant workers, and BBMP officials have been struggling to deal with this crisis on their own. Labour officials are also grappling with the challenge of ensuring food supplies to those who actually need it. People who have supplies at home are said to be turning up to collect free rations, and many more are picking up multiple packets. Doctors and public health experts have condemned the move to issue temporary emergency passes, saying it is too complicated for someone in a life and death situation. The police department has issued a memorandum authorizing family members of people in medical emergencies like pregnancy, childbirth, accidents, and death to get 12-hour passes from local police stations amid the nationwide lockdown. Before we go, after efforts to sanitize and decongest Kalashipalli market failed, the historic trading hub was moved to Electronic City. Now it seems like the move could be permanent. The market has moved to a 41-acre area at Electronic City. That's all we have for today. Stay safe, stay indoors, and we'll see you tomorrow.